what are the risk factors of HPV and how it is associated or how it is important?
So, sometimes we feel like for some infective diseases that we wear a mask or we use sanitizer or if we stay away, we will be protected from this.
Correct.
So, HPV is a ubiquitous virus. Ubiquitous means it is there everywhere. It is there on the skin and all of us get exposed to it. Sometimes through close to skin contact, like people who share a room or sometimes who stay close. There are certain HPV viruses which spread only by skin contact and they cause warts. They don't cause cancer.
Achha.
Skin warts on the face, on the skin. Sometimes you have skin tags. They can cause in the genital area and personal private areas also. And some which are spread by sexual contact. So it can happen more in high risk sexual behaviors like homosexual, people who have a homosexual preference or through anal intercourse or oral intercourse also. So HPV is there everywhere. So we cannot run away with it. People may think that if we touch something and if we use a hand sanitizer, it will get cleaned away. HPV doesn't die by a hand sanitizer. So there is no way to protect it. But we can practice certain things to be safe from HPV. Okay. All of us will get HPV at some point of time, either through contact or once we are married or sexually active, we will get it. But our immune system tends to clear it. How we have to or how we can protect ourselves is by using barrier contraception if people who have multiple sexual partners, not or giving up smoking or quitting smoking or keeping good health for yourself. That is one. And then regularly, obviously for women, a regular cervical screening or cervical program, because we can pick up HPV infections earlier. There are good tests. So this is how we can, means basically what HPV is or what is the importance of HPV in terms of it being there for everyone, but it gets cleared off. In people in whom it remains for long, it can cause abnormality of cells, and in women, it takes about 10 to 20 years if they have that infection for it to progress to cancer. So there is a big time for us to pick up that infection, pick up the cancer before it becomes cancer and treat it.